why, but I kind of like veered the opposite direction, started hanging out with the wrong people. I became a wrong person. I started smoking weed at 12. I don't even think I was 13 yet. Drinking, I started doing pain pills, and then it progressed into heroin.
It's an emotional roller coaster for us. Responding to a 911 call for a possible overdose, we're automatically thinking, okay, what could it be? What resources do we have?
My daughter was overdosed by fentanyl poisoning. We did CPR on her, I think, for 13 minutes before the ambulance got there, which, had we not known how to do CPR, had we not found her in time, had all the stars not aligned, she wouldn't have made it. She would have been just another number.
Every day there's people that are overdosing. Unfortunately, the people die. I see that firsthand. Our community is not immune to it at all. It's here.
I think every community in the United States has been significantly affected by the opiate crisis. There's nowhere that this doesn't touch. Every family in America has either been affected by or knows someone who's been affected by substance use disorder, addiction, and the tragedies that happen with overdose. And there are problems that happen here as well. We're a smaller area, so each person we lose is a bigger part of our community. And so no matter whether it's one person or 10 people or 100 people, every person is someone who is dear and has a connection here, and we would much rather find a way to help them than to lose them to something like substance use disorder.
We've responded to numerous calls weekly, monthly, yearly, and we see the effects of what the drugs are doing to our community and how it's tearing us apart. A lot of it depends on how fast we can get there, how fast the person recognizes the need for help. We've had several cases where it's too late for us to do anything. We've had other cases where we can get there, we can reverse some of the effects of some of the drugs, get them stabilized, get them to the hospital, and then get them in there. Unfortunately, lots of those are repeats. We'll get them stabilized and treated this time, but the next time, it may not be so lucky. The tragedy is when we get there and it's too late for us to do anything. It's heart-wrenching to have to turn to a mother, a father, a sibling, a child that may be in the house and tell them that we can't do anything.
In 2021, I had 11 opioid-related deaths. 2022, we had 6. Those are people. Those numbers are people. That could be somebody's son or daughter, husband or wife, brother or sister, grandchild. And that number was a person. They had a name, and they had hopes and dreams and visions. This wasn't the way they intended to leave this world.
If we don't do something to start educating people and letting people know that there is a true addiction problem, not just in this community, throughout the United States, I think people are aware of it, but they just don't think it's here in St. John. They think it is elsewhere. They think of big cities. They think of larger populations. They don't think of St. John being a abuser area.
So I was just a normal person, normal kid growing up. When I was 12, my dad came to me and he asked me, he goes, hey, I've been offered a better paying job, but I'm gonna have to travel a couple nights out of the month. And I'm like, okay, whatever, well, then a couple nights turned into 2-3 weeks out of a month. And when that happened, I don't know why, but I kind of veered the opposite direction, started hanging out with the wrong people. I started smoking weed at 12, drinking. By the time I was 15, I was drinking and smoking all the time. I ended up on probation from sneaking out of the house and getting caught past curfew. I got a minor in possession of alcohol, and it just progressed and progressed and progressed. I ended up getting 2 DWIs within a year, lost my license for a year, had to get an ignition interlock put in my vehicle, and that's when things got even worse because I hated being stuck somewhere. So if I went somewhere and started drinking, then I was stuck. So I didn't drink, I started doing pain pills, and then it progressed into heroin. Since I wasn't into like sports and stuff like all my classmates, I didn't feel like I fit in anywhere. So when I started hanging out with certain people and they were doing these things, I guess all I really wanted to was to fit in. And then I grew to enjoy it. I like to just have fun and party, kind of like people do now, but I just was extreme with it. Anything I did, it was extreme. It was never just, oh, I'm just gonna do a little bit, or I'm just gonna have one drink. That's not how it works. Once I got to heroin, it was over with. There was no more fun. It was, I have to use it to function, or I just couldn't get out of bed.
Substance abuse is an epidemic that we need to get a control of in order to reverse the effects of it. I mean, this is devastating lives, families, friends, careers. It takes a productive person out of society and puts them in a tailspin. And it doesn't matter if they are coming from the nicest part of a town or if they're coming from the worst part of town. The addiction problem knows no boundaries.
Back in, I think it was 2015 or 2016, the union that I belonged to, they sent out a message to all the labor locals that people were getting in trouble a lot with opiates. And that's when I started getting involved in what the signs were, what to do, how to do it, and trying to help as many people as I could survive fentanyl poisoning. There was a lot of people down here that had the mindset of let them die. You know, they got themselves into this problem, you know, they can get themselves out. And just in my day-to-day travels, I found actually people who cared. And we got this small group together. It was myself and the health department and the mayor at the time. And that blossomed into other people getting interested, and that's when we started the Resources to Recovery. There was 4 of us in the beginning.
Resources to Recovery is a fabulous coalition that is right here in St. Genevieve County. We have resources such as New Vision, withdrawal management, of course, community counseling, Gibson Behavioral. We also have a mobile unit that comes from Gibson every other week.
It is just a collection, a group of people from different parts, different agencies in our community that are interested in promoting the well-being of individuals that live right here, our neighbors, our friends, our family members. I work with people of all ages, but primarily our goals have been related to helping adults. We do work and partner with the schools in some prevention education efforts, but mostly we are seeing that the adults in these children's lives need access to resources that can lead them to recovery.
Once you're able to break down the barriers, meet people where they're at, basically. Some people are still very hesitant to open up, but it's okay. You know, we're not taking notes. If someone needs Narcan, we get them Narcan. We don't care why. If they want or need it, they got it. If they want or need counseling or want to find a place for recovery, we'll do everything we can to help them through that process.
We are trying to collaborate together to bring awareness, to break the idea of stigma that goes along with substance use disorder, that we're able to provide the different resources that are available so that we can best help our community.
Our funding from Resources to Recovery, we're funded through grants and from money from the opioid settlement that our county has received. So our county, we've decided, this money that we're receiving back from the opioid crisis, we're going to do something with it. We're just not going to just spend it. We want to use it to educate and to treat people.
The decision to get help, and that's on the individual themselves. That has to be their decision for this to work. I truthfully feel that. But after that decision has been made, we have to have things available for them. The mental health services that are needed, rehabilitation services that are needed, transportation to these services, to kind of start putting their life back together is important. In my role specifically, if I have an individual come into the health department saying, I need help, I need Narcan in my home, this is what's going on, my first step is actually reaching out to someone other than me. I have a great list of resources at the health department. I have individuals who have far more knowledge than I do about this, whether it be someone that can help them get insurance so they can get bed placement somewhere, or get them into a treatment facility. We at the health department, another resource we have is an after-hours volunteer, which is wonderful. They hold a separate cell phone that belongs just to us and some of our Narcan supply. That if an individual needs Narcan after our workday is over, they can call that phone, and this individual or myself can meet someone within city limits and give them the Narcan and resources they need in that moment.
Here at New Vision, we do withdrawal management, so it's basically a medical detox in a hospital setting. So when patients come to us, it can be really a scary situation to reach out for help for. But when patients come to me, I'm able to alleviate a lot of those fears by talking with them, connecting with them, and letting them know all of the care that is available here. Post-discharge, I assist them with a strong aftercare plan. Those aftercare plans often look different. There is residential treatment. There is medically assisted treatment. That is basically where there are medicines available to help them sustain recovery. There is also outpatient treatment services, counseling. There's a lot of resources out there, and my position is each person that I speak with is different. And so I basically identify their needs and what would best suit their situation.
He came in, he said he had been to a meeting, and we were sitting there waiting for him to come back up to, eat. And he never did. He had the door locked, and he never has this door locked. We had to pretty much break the door. Got in, and he was on the floor, and I'm just screaming his name, and then he just wakes up. Never had I seen any drug paraphernalia, and there was a syringe there. It had a thing over it that I guess you put through the nasal passage or whatever. I just took it. I'm like, what is this? What is this? And he told me it was something that he just needed to sleep, and you can get this over the counter. And we talked about it, said, you need more help than we can give you here. And he goes, I'll do whatever you want. I said, okay, well, we're gonna have to talk about this in the morning. And we thought everything was good. So I didn't get back home till about 3 o'clock the next day. I went down and I found it. I know what Bart struggled through, and I know the years I had with him, and I know the kind of person he wanted to be. I know what he wanted to be. He was a good person. And just because he had these problems doesn't make him less. And I never gave up hope because I know what he wanted to be. But this took him out. I do want to encourage people to reach out. Don't be afraid that, okay, my kid's going to be stigmatized as a druggie or anything else. You are fighting for your child. Don't be afraid to reach out and use the resources available to you, because at this point you could be their only hope, and whatever help you can get. Programs like this are designed to try to help people in your situation, and don't be afraid to use it. You hate to think of the worst outcome, but when that happens, you want to make sure you did everything you could to avoid it.
So if you're a family member and you have a loved one that is an addict, is going through the addiction, it's really hard to break down the stigma barriers, and you feel like everybody is judging you and you don't want to reach out for help. I would just encourage you to reach out to one of us and to let us do the work behind the scenes and know that you will not be judged, and kind of walk you through the process. And when the time comes, when the time is right, we'll have everything in place. If you have someone that's in addiction that's not ready, they're not ready. You can't force them to be ready. My personal history is I had a son that was an addict, and I couldn't pray him into recovery. I couldn't cry him into recovery. I had to be patient and wait until he was ready to go into rehab. And it took years. So I have walked that walk with him. It's not an easy road. So I think everybody comes to terms with it in their time. You can't force it. But we have to have a program in place when they're ready, because it is difficult to get somebody into rehab.
So I'm coming up on 8 years clean and sober. I kept myself extremely busy because that's what I was kind of taught in drug court. And then it just became a habit of staying really busy. And now I'm trying to figure out how to get out of that habit of being so busy, which is hard to do. And I have 2 kids and a wife, and I feel great knowing that I can look at them and not be drunk or high. And knowing that they get to grow up and never see their dad drinking, I just like the fact that they'll never see me doing that.
First of all, recovery is possible, that there are a number of people who are willing to help them through their journey, including getting treatment for withdrawal and that early stage. There are so many pieces of the puzzle, and it kind of depends on where that person is in their walk. If they need help with withdrawal, there's medical treatment for that. If there is maintaining sobriety, there are different resources for that. We've got connections with all those pieces, and we have the inpatient treatment, the emergency treatment. We have mental health workers as part of our clinic infrastructure, and then we connect with agencies, everything from helping secure housing to ongoing treatment to those peer support agencies, so that these people can live the best life they possibly can.
If it's a professional that is seeking more information or education, that Resources to Recovery offers educational opportunities for them so that they can be more aware of the resources and just be more up to date and learn how they could approach addiction with the clients they serve. I want individuals and members of the community to know that we are here and that we are open to having these conversations with them.
I'm here to listen, no judgment. I'd like to help you get resources over at the health department, whatever we can do. And I'd just like for them to know that there are people in this community who do care, and we're trying to get the help that we need here.
If you're someone that is struggling and needs help, let us help you.
Resources to Recovery, based in St. Genevieve, Missouri, presents this video to you. Resources to Recovery aims to provide support and assistance to the residents of St. Genevieve County who are focusing on recovery from addiction. If you have any specific questions or need more information about Resources to Recovery or their services, feel free to reach out to us.